Hello, NBC Days. I hope you guys are doing good. My code squad, everything good here. Today we're actually going to be going through part of the slides for Introduction to Electronic Health Records, Chapter 1, Part 1. So if you guys don't have your book out already, I'm just going to, for the newer ones, in case you're unsure of which book, this is the book. And I hope you've already done it, but you have to follow instructions here on how to register this book. When you register this book, it has nothing to do with the SIMS charting book. It's two different things. I want to talk a little bit about this, and I want to make sure that you understand. This book is by Evolve/Elsevier or Elsevier/Evolve. And that's where you're registering this. Guys have driven me crazy with the SIMS charting book. This book comes from Canvas. It is actually an extra resource from Elsevier/Evolve, Evolve/Elsevier. But this book you have to get into your Canvas account for. But we're not using this book right now. So I'm going to put it to the side. Let's focus on this book. So what you're going to find in your resources for this book are some practice quizzes, and I'm actually going to be posting your actual quizzes, and you'll be able to take those online. I'm hoping. That's the theory anyway. I'm not sure how I'm going to do that. We'll talk about it later. But I want you to go ahead and turn to page 1. This book has some really, really great features. On page 1, you're going to see that it has an outline of everything that's in your chapter for you. It's got your chapter objectives, and it's got your key terms. I cannot stress this enough, ladies. The key terms in this book are so important. Those of you who have been practicing your NCCT exam questions, you're going to recognize so many words that you didn't know before, but have learned through that practice where those actually came from in our curriculum. So this is where they came from. Words like audit or account ledger. There's chief complaint, and we've gone through that. Meaningful use, day sheet, co-payment. I'm not going to go through all of them. Please, please, please pay close attention to your key terms. All right, so we're going to move on from that. I'm actually going to talk to you about what's on page 2, the history of medical records. And I'm not going to read the whole thing, but I want to make some points. Nearly as long as there have been physicians, there have been medical records. A patient medical record is a complete physical collection of an individual's healthcare information. So that's what a medical record is. It's just showing everything that a patient has been through in their, I don't want to say medical career, because that's not what we want. We don't want to make a career out of being sick, but it's a collection of all of their procedures, diagnoses, doctor's appointments, things like that. So I'm going to go down to the second paragraph. Medical records and death ledgers were kept during the plagues that swept through Europe during the 14th and the 17th centuries. In the United States during the Civil War era, soldiers' medical records documented nervous disease, later known as shell shock, and new post-traumatic stress disorder. We all have heard that one. As well as injuries suffered in combat and infectious diseases contracted in the crowded, unsanitary military camps. Now, I have a lot highlighted because I like history and I thought this was so important. But you guys need to read through that. For this time, we're going to actually start our slides. So these are our objectives. I'm not going to read through those, but I really like for you guys to write these down or read them. And as we go through our chapter, I love that I want you to really be able to pick out what your objectives actually are, because so many times our objectives is what's on our test. So what is a medical record? It's a physical collection of an individual's healthcare information used throughout history to document patients' healthcare, signs, symptoms, diseases, trends of diseases. Each patient has his or her own record. Documentation is a vital component of the EHR. Okay, documentation is absolutely pertinent for us because if it's not documented, it did not happen. So if it's not documented, we cannot code it. So it contains health information, administrative information, and legal documents. Clinical information. Here's a list of clinical information for you. Medication lists, allergies lists, immunization records, laboratory reports, pathology reports, vital signs, growth charts, surgical reports, hospital records, history and physical assessment findings, progress notes, radiology reports, imaging, and test results. How many of those things do you recognize? Should recognize most of them. Even just taking our kids to the doctor, we recognize those. Administrative information are patient demographics, the name of emergency contact person, patient correspondence, referral and consultation letters, insurance information, HIPAA claim status, billing account ledgers, super bills and counter forms, day sheets, appointment history, diagnostic and procedure codes. Okay, these are a list of what legal documents are. Records release, informed consent documents, HIPAA forms, advance directives, living wills, insurance authorization forms, and healthcare power of attorney forms. If you do not know what any of these things are, please take the time and Google them. You need to know what these individual forms or documents actually are, please. Documenters of the medical record. Individual who is responsible for inputting information into the health record. Well, who would that be? It could be the documentator, the receptionist, the medical assistant, the physician or other treating professional, and the medical biller. Structured data entry and free text documentation. Okay, this is so important. Who actually owns the medical record? The information is the property of the individual who created it. So it's my social security number, my address, my insurance member number. But the physician office owns the physical record. So what would the physical record be? The paper. The physician owns the paper that it's on. Patient owns the medical information, which would be what was on the paper. You may obtain a copy by signing a records release and may be charged an administrative fee. What happens if a patient's released from the practice and they want their medical records and they refuse to sign a release form? They can't have it. You want your medical records. It's required by law for us to get a release form. And there are certain offices that will give them a copy of that after they sign the release form, and they charge them for the copy. That is up to your individual facility, though. Okay, so we need to know who actually owns the medical record. The record is on paper. We own the paper. You know, I like visuals. The EHR, patient medical record in an electronic format. There are 8 core functions of the EHR system. Health information and data management, results management, order management, decision support, electronic communication and connectivity, patient support, administrative process, reporting, and population health. Transitioning from paper to electronic records. Excuse me. Bush administration declared in 2004 to 2014 the decade of HIT, Health Information Technology. Office of the National Coordinator for Health Information Technology. You see, that's what that stands for. The ONCHIT, ONCHIT, promotes universal meaningful use of EHRs. For example, computerized provider order entry, CPOE. Transitioning from paper to electronic records continued. As of 2007 through 2008, only 17% of practices are have adopted an EHR system. I'm not going to read the next part of statistics. I do want to hit meaningful use, and then I'm going to tell you something. Meaningful use incentive program. Improve quality, safety, and efficiency. Engage patients and family. Improve care coordination and maintain privacy. So what I want to tell you is we're 2020, right? That's been a long time ago. Actually, Medicare is offering any office, excuse me, guys, actually financial incentives to actually be completely electronic. If you don't, then they're actually penalizing you. EHR systems to go completely electronic, they were expensive, but the incentives that Medicare offered financially were actually making up for that expense. Some facilities, a lot of facilities are still hybrid. There's some electronic and then some paper. So that's just what I wanted to tell you about that. Okay, EHR versus EMR. What's an EHR? Electronic health record. What's an EMR? Electronic medical record. There's just tiny differences. Okay, they're interconnected. Aggregate all of the patient's health records, data from multiple providers, data from multiple healthcare facilities, electronic patient record created and maintained by a single provider, and component of the EHR. Basic EHR functions are fax and messaging, patient reminders, vital signs data, importation of data, automatic flagging, email, print, progress note, documentation templates, provide review of incoming data, image attachment, electronic signature insertion, prescription template. Clinical decision support allows providers to set protocol for specific patients and/or conditions based on evidence-based treatment protocols. Automated preventive care reminders, treatment plan templates, generate patient data reports, and documentation templates. Practice management software. That's also called PMS. I always think that makes me smile, but administrative software used for patient demographics, billing and insurance information, appointment scheduling, advanced accounting procedures. These tasks are now incorporated as part of the EHR. So this is just a little picture of figure 1.4. The patient demographics tool in SCMO, that's your SIMS chart for the medical office, stores all of the information on 3 tabs: patient, guarantor, and insurance. Here's another picture. And that's actually where we're stopping today. I'm sorry I've had to look at my paper some. I'm still learning all of this. But those of you that hung in with me, I'm so glad that you did. I have a question for you to answer, and I want you to actually submit this to me. You can submit it. Yeah, I think you can open this. You'll be able to open this, and you'll be able to submit the question I'm going to ask you. I want you to give me the 8 core functions of the health record, EHR, please. The 8 core function of EHR. So, ladies, if you hung in with me and you're thinking, boy, I don't want to do this, I will be asking questions at the end. And hopefully you will give me those answers because they'll be part of your grade. I hope you guys have a wonderful afternoon. Let me know if you need anything. Talk to you soon. Bye-bye.